What if the cough, dizziness, or strange symptoms you've been blaming on aging are actually connected to a medication you've been taking every single day? Not allergies, not a cold that won't quite clear, not just getting older. Lisinopril, one of the most prescribed medications in America. Millions of older adults take it every morning to protect their blood pressure and their heart. And it works. For the right person at the right dose, it is genuinely valuable. But here is what most people are never told when they leave with that prescription. Lisinopril creates very specific changes in the body, changes that produce symptoms almost universally dismissed as aging, as weather, as just how life feels now. Symptoms that have been quietly managed at home for months or years by seniors who had no idea a conversation with their doctor could change everything. I'm going to walk you through 7 warning signs today. Some will sound immediately familiar. Others will surprise you. And the final one, the one I've saved for last, is the one that has sent people to the emergency room, gasping for air, with families watching in terror, with doctors moving fast. I want you to hear it. But first, 7 things your body may already be trying to tell you. 7. And I'm starting here because this symptom is experienced by up to 1 in 5 people on lisinopril, and almost none of them connect it to their medication. A persistent dry cough. Not a productive cough. Not the cough of a chest infection or a cold. A dry, tickling, throat-clearing cough that is simply always there. That gets worse when you lie down. That disrupts your sleep. That makes you clear your throat in conversations until it becomes embarrassing. That you've been attributing to allergies, to dry air, to postnasal drip, to whatever explanation came to mind first. Lisinopril works through a pathway that causes a specific compound to build up in the airways. For 1 in 5 people, that buildup creates ongoing irritation, a cough that will not fully resolve no matter how many cough drops you take, because the source is still arriving every morning with your medication. This cough is not dangerous in itself. But here is what makes it important beyond the annoyance. A cough that disrupts sleep disrupts everything. Immune function, cognitive clarity, mood, energy. The quiet accumulation of poor sleep over months adds up in ways that look, eventually, like accelerated aging, because the body never fully recovers from one night to the next. And almost nobody is told, when they're prescribed lisinopril, that this cough is a recognized, common, entirely medication-related side effect, for which there are equally effective alternatives that do not cause it. If you have been coughing since starting lisinopril and have been managing it as something separate, something unrelated, you deserve to know. That conversation with your doctor could end the cough that has been following you for months or years. Have you developed a cough since starting a blood pressure medication? Tell me in the comments. You may be surprised how many people are experiencing exactly the same thing. But the cough isn't what worries me most. The next warning sign is the one that creates the most immediate physical risk, and most people don't recognize it until they're already reaching for the wall. 6. Dizziness when you stand up. You've been sitting. You rise. The room tilts. You reach for something solid. You wait for it to pass. You tell yourself you stood too fast. That this is just how mornings are now. Lisinopril lowers blood pressure. When you stand, your body needs to push blood upward to the brain quickly. When the pressure is running lower than your specific body needs, which varies significantly by person, especially after 65, that compensation is delayed. For a few seconds after you stand, the brain receives less blood than it requires. Those seconds feel like dizziness. They pass. But every single time, they create a window of vulnerability. A woman named Ruth was 72. She'd been on Lisinopril for 3 years. One morning, she stood up from the bathroom floor after picking something up, and the room spun hard. She grabbed for the towel bar. It pulled loose from the wall. She went down, hit the edge of the tub, and fractured her hip. 6 months of recovery. A walker for longer than that. An independence she had maintained fiercely for years, suddenly requiring her daughter to move in. Her cardiologist later found her standing blood pressure dropped 32 points within 60 seconds of rising. A simple dosing adjustment resolved the dizziness. Ruth told me, "I'd been feeling that dizziness for months. I thought it was just age. Nobody told me I should mention it." If you reach for walls or furniture when you stand, please don't accept it as normal. That symptom has a name, a cause, and very often a fix. But the next warning sign is the one that sneaks up over months. And the reason it's so dangerous is that it looks exactly like something seniors are told to expect. 5. Extreme fatigue that doesn't improve with rest. A heaviness that starts before the day has asked anything of you. A tiredness that makes ordinary tasks feel like effort that doesn't match what's being asked. A slow withdrawal from activities, from plans, from the life you intended to be living. When lisinopril lowers blood pressure more than an individual body needs, and this happens more commonly in older adults whose bodies respond differently to medication than they did at 50, every organ receives slightly less driving force. Muscles feel heavy. The brain runs slower. Energy becomes something that has to be conserved rather than spent. Most seniors adapt. They slow down. They tell themselves this is just what getting older feels like. And the quiet tragedy of that adaptation is this: the walks get shorter. The trips don't get booked. The grandchildren get visited less often because the energy for it isn't there. The world narrows, not because of illness, but because of a medication dose that may simply need adjustment. If your fatigue arrived or changed around the time your lisinopril was started or increased, that timeline is a clue worth bringing to your doctor specifically. And what comes next, warning sign number 4, is the one that catches people off guard because it doesn't feel like a blood pressure problem. It feels like a muscle problem, or a kidney problem, or sometimes like the body simply shutting down for reasons nobody can name. 4. Unusual muscle weakness. A heaviness in the legs that doesn't come from exertion. Difficulty climbing stairs that used to require nothing. A feeling that the body's strength has been quietly borrowed from without permission. Lisinopril affects how the kidneys manage potassium. In some people, particularly those with any degree of reduced kidney function, which is very common after 65 without any obvious symptoms, potassium levels can rise above what the body can safely manage. When potassium runs too high, muscles don't work the way they should. They fatigue faster. They feel heavy and unreliable. They ache without a cause. And in more serious cases, the heart muscle, which depends on potassium balance for its electrical function, begins to show the strain too. A man named Edward from Cincinnati was 76. He'd been on lisinopril for 2 years when he noticed he couldn't climb the stairs to his bedroom without stopping halfway. He stood there one night, holding the railing, breathing harder than he should have been, and thought, "This is how it ends. This is the beginning of not being able to live in my own home." His daughter brought him in. His potassium was significantly elevated. His kidneys, which had been quietly declining for several years, as kidneys do, without a single obvious symptom, were no longer managing the potassium load lisinopril was creating. His medication was adjusted. His potassium normalized. He climbed those stairs the following week without stopping. He called my office to tell me. He said he just wanted someone to know. If you are on lisinopril and have not had your kidney function and potassium checked in the past year, please ask for that blood test at your next appointment. By name, kidney function and potassium. It takes 5 minutes. It protects you from the most serious lisinopril-related risk that most people never see coming. But we're not at the most serious one yet. The next warning sign is one that masquerades so convincingly as something else that it can slip through years of medical appointments without being properly connected to the prescription. 3. Confusion. A mental fog that arrived gradually. Memory lapses that weren't there before. A slowness to thinking that you've been privately afraid might be the beginning of something you're not ready to name. When blood pressure runs lower than the brain of an older adult needs, cognitive function is affected. Not dramatically, not suddenly, but in a creeping, gradual way that looks indistinguishable from the inside from the earliest stages of decline. Processing slows. Short-term memory becomes unreliable. Concentration requires more effort than it used to. And because it arrives slowly, and because it looks so much like what people expect aging to look like, most seniors accept it. Their families grow quietly worried. Nobody traces it back to a medication change that happened 6 months earlier. I have sat with families carrying a fear they hadn't fully spoken out loud, afraid that what was happening to the person they loved meant the beginning of the end of independence. And we traced it to a lisinopril dose adjustment. And we made a change. And 6 weeks later, the calls came in. The person they remembered was back. Cognitive fog that appeared around a medication change is a clue. Bring that timeline to your doctor. My thinking changed around the time my medication changed. I want to understand if there's a connection. That sentence opens a door most people never find. But there are 2 warning signs left. And the second to last one is the one that most commonly precedes a medical emergency, the moment most seniors dismiss right up until it cannot be dismissed any longer. 2. Fainting, or the terrifying moments just before it. Everything going gray. The sudden, overwhelming dizziness that forces you to sit down immediately. The cold sweat that comes from nowhere. The sense that the room is about to take you with it. Pre-syncopal episodes, the clinical term for near fainting, are among the most dangerous consequences of blood pressure running too low. The brain, not receiving adequate blood, prepares the body for unconsciousness. The warning signs are the body's last attempt to get you horizontal before the fall happens. In older adults, these episodes are not minor. Fainting is a fall with no reflexes engaged, a complete collapse with the full weight of the body behind it. Heads hit floors, hips fracture, and the confidence that allows a person to live independently, to move through their own home without fear, to walk to the kitchen alone at night, can be destroyed in one unwitnessed moment. If you have experienced even one episode of near fainting since starting lisinopril, one moment where you had to sit down immediately, where everything went gray, where you felt seconds from going down, please bring that to a physician this week. With the date, with the time of day, with what you had eaten. That information, specific and documented, is what allows a doctor to understand what the medication is doing at its peak effect in your specific body. But none of what I've described, not the cough, not the dizziness, not the weakness, not the fog, not the near fainting, none of it is the warning sign I most need you to hear. The one that comes next can move from nothing to life-threatening in under an hour. Please stay with me. 1. Swelling of the lips, the tongue, the face, the throat. It may begin as a strange tingling on the lips that feels almost like a mild allergic reaction, or a subtle puffiness under the eyes in the morning, or a feeling in the throat that something isn't quite right, a tightness that comes and goes. At first, it seems harmless, unfamiliar, but not alarming. People wait to see if it passes. Often, in the beginning, it does. And then, one day, it doesn't. This condition is called angioedema. It is a rare but documented and genuinely dangerous reaction that can occur with lisinopril, sometimes after years of taking the medication without any previous sign of it. The same pathway that causes the chronic cough in some people can, in a smaller subset, trigger a more serious inflammatory response involving the soft tissues of the face, mouth, and throat. When the throat swells, breathing becomes difficult. Then, difficult becomes restricted. The window between the first sign of throat involvement and a true airway emergency can be measured in minutes. I want to tell you about a man named Thomas, 71 years old, retired teacher. He'd been on lisinopril for 4 years without a single problem. On a Sunday afternoon, he noticed his upper lip felt slightly swollen. He showed his wife, who thought it looked mild. He took an antihistamine and lay down to rest. By the time his wife came to check on him an hour later, his lips had doubled in size. His tongue was visibly swollen. When he tried to speak, his voice was muffled in a way that frightened her. She called 911. The paramedics arrived to find Thomas sitting up, struggling to breathe, his throat narrowing rapidly. He was given emergency medication in the ambulance. He arrived at the hospital with his airway barely maintained. He spent 2 days in the ICU. His wife told me afterward that she had almost not called, that she had almost waited to see if the antihistamine worked, that she had thought about not wanting to make a fuss. Thomas is alive because she called. If you experience any swelling of the lips, tongue, face, or throat while taking lisinopril, any swelling at all, however mild it seems, this is a 911 call. Not a wait-and-see situation. Not a take an antihistamine and rest situation. An emergency call. Because what begins mild can progress to life-threatening faster than most people realize is possible. This reaction can occur in someone who has taken lisinopril for years without any previous sign. It does not require a prior allergic history. It requires only that the medication, on a particular day, triggers the reaction it is capable of triggering. Your doctor needs to know if you experience any facial or throat swelling while on this medication. If it happens when you cannot reach a doctor, the answer is 911. Without waiting. Before I close, here is what I want you to take from this conversation. Write down any of the 7 warning signs you recognize today. A persistent dry cough. Dizziness on standing. Fatigue that rest doesn't fix. Muscle weakness or heaviness in the legs. Mental fog that appeared around a medication change. Near fainting episodes. Any swelling of the face, lips, or throat. Write down which ones and when you first noticed them, specifically whether they appeared or worsened around a change in your medication. Bring that list to your doctor as the first item on the appointment agenda. I've been tracking symptoms, and I want to understand whether my lisinopril could be contributing to any of them. Ask for kidney function and potassium if you haven't had them checked in the past year. And know this absolutely. Swelling of the face, lips, tongue, or throat? Call 911. No waiting. No antihistamine first. Call. Do not stop this medication on your own. Blood pressure that goes unmanaged carries serious risk. Any change must be supervised. But the conversation about whether your dose, your timing, or your specific medication is right for your body, at your age, with your history, is always worth having. Your body whispers before it screams. The people who stay healthiest are usually the ones who notice those whispers early, who bring them forward before a whisper becomes something that cannot be walked back. Today, you heard 7 whispers. One of them could save your life. Tell me in the comments, have you experienced any of these symptoms on lisinopril or another blood pressure medication? Did the cough section sound familiar? Were you aware of the swelling risk? And if this raised questions about someone you care for, share this with them. Because sometimes the most important information is the kind that arrives before it's needed. There's another video here about how to have the most effective conversation with your doctor about blood pressure medications, what to say, what to ask, and what most patients never think to bring up. It follows directly from everything we discussed today. Take care of yourself. And if anything swells, don't wait. Call